Hello and welcome back to ECR Studio. I'm Mélisande Rouget and I'm very happy to be introducing our next guest. The SOLACE project assesses the current state of policies, needs and best practices of lung cancer screening in the EU. Thank you for bearing with me. The project issues guidelines and implementation packages, and it has also rolled out 3 pilot projects in 10 member states to increase participation. So we will now hear the last updates of the project. Please welcome our guest, Dr. Helmut Prosch, Associate Professor at the Department of Biomedical Imaging and Image-Guided Therapy at the Medical University of Vienna. Hi, Professor.
Hello, good evening.
Thank you for coming.
Great pleasure to be here.
And I hope you can still understand
Yes.
me.
I'll try to speak more so you don't lose your voice.
So can you please tell us what motivated the initiation of the SOLACE project and how does it aim to address the various challenges associated with implanting lung cancer screening programs in so many different countries?
Yeah, that's a very good and important question. As you may know, there have been a number of screening trials all over the world, in the US and in Europe, and all of them showed that lung cancer screening is effective. But to our surprise, and also to the surprise of the scientific community, it is really difficult to start with lung cancer screening in wide projects, not limited to some pilot projects. So, and this is also something the European Union understood. And that's why the European Commission initiated this call in the framework of EU for Health to implement lung cancer screening, or to ease the implementation of lung cancer screening throughout Europe. And this is not a research call. This is directed to start screening, to ease the screening in Europe, throughout Europe. So what we did is we came up with a proposal which was ultimately accepted, the SOLACE project, where we tackle a number of questions which we feel are still important and need to be tackled to ease the implementation of lung cancer screening throughout Europe.
It's a big job that you have ahead of you.
Yeah, but it's an interesting job, you know.
Yeah.
So there's so many questions which are open. One is we would like to investigate the opinion of key opinion leaders throughout Europe to learn from them where they feel what needs to be tackled, which needs to be changed, where they see open questions. And then we also need to address the elephant in the room, the costs. So also cost effectiveness analysis is one of the topics which will be addressed in SOLACE.
And one of the key challenges of the SOLACE project is implementing guidelines.
Oh, yes.
How actually do you ensure that they are consensus-based and they are applied by all stakeholders in Europe?
Yeah, this is the beauty of this project, that we have involved so many stakeholders. We have included the main stakeholders when it comes to European societies. We have national societies which are active in our project. We have universities active, and we do also get feedback from political leaders. And what we do is we will, in the first step, we will write a couple of white papers where we address specific questions, which are not guidelines in and of themselves, because for guidelines you need more thorough literature research, you need a more systematic approach, but that is ultimately also the goal, then to come up with guidelines which ease then the implementation, because guidelines are the key for the progress in that field.
Given the varied conditions across EU member states, I mean, we're talking about countries that have different healthcare systems. How does SOLACE plan to demonstrate the effectiveness of implementation of lung screening programs?
Yeah, what we are doing is we are hooking up on existing projects. So there's one nationwide screening program, that's a project, a program in Croatia, which is part of our project. Then with the individual projects, on a smaller level in different countries, like in Hungary, in the Czech Republic, in Germany, and other countries, France. And there in this project we are adding some specific questions to be solved, so issues to be solved, like how can you reach people who usually do not participate in such healthcare projects, socially deprived persons at risk due to the exposures in their working environment. So these are people which are usually not that easy to reach. So we came up with the idea to have some ambassadors or mediators which will help to include more persons.
From different communities.
From different communities, yes.
What
like Roma, yes, Roma or other socially deprived people. These are not patients, these are otherwise healthy persons. And then also women, because we know that women profit more from lung cancer screening than men. So that this is also something we specifically address in a project which is led by Marie-Pierre Revel from Paris. And then we do have Martina Vašáková in Prague, who will address the patients then who are at risk for lung cancer, like patients with COPD, chronic obstructive pulmonary chronic disease. Sorry, it's late in the evening. It's my field.
I understand you.
And then also patients with after transplantation, so forth. And then the socially deprived program is led by Ildiko Horvat from Budapest. So it's already widespread. So that's really important that we get not just in some few countries. It's quite widespread all over Europe.
And could you maybe share some of the insights into the objectives and the methodologies used in the 10 EU member states?
Yeah, as this is a hookup on existing programs, and this is not a research project, so we don't have specific research goals, because this was not in the call of the European Commission. So we have this project where we, for an example, invite specifically women to participate, so with folders, with advertisement and so forth. And this is based primarily on the experience from France. And we will, in the first step, evaluate how many women participated in it without these advertisement projects. And then after the advertisement, again, investigate how many persons, women, then participated, so to see the effect.
So it's a bit like you take the experience from different countries,
exactly,
see how it works, and build on it.
But that's exactly the beauty here, because it's not just one single country. We are Europe. Europe is so diverse when it comes to languages, cultures, and so forth. So it's not one method fits all purposes. So that's why this makes this project so interesting, that we have the input from more than 10 screening projects all over Europe.
Yeah, it's amazing. I mean, and what will happen after the project ends? How will you make sure its sustainability over time?
Exactly. Also, this is really important, because there are so many projects which then die after the end of the project. What we aim here is we will found this so-called Lung Cancer Screening Alliance, which has members from the big societies, from other stakeholders, where we have the specific aim to continue on with that work. Yeah, so we will continuously work on guidelines. Then one aspect is also to provide education training for physicians involved in lung cancer screening. As you may imagine, lung cancer screening is quite specific. It's not something what we do in our daily life. So you need to train radiologists, you need to train pulmonologists, general physicians, thoracic surgeons. They all need to get some more knowledge about the particularities of lung cancer screening. So we will not provide a school, if you will. We will come up with training curricula which are coordinated between these different specialities. We have here experience from the European Society of Thoracic Imaging, which already has this training program, and learning from them, we will then come up with this coordinated training curriculum, a proposal of it.
Wonderful. I have an extra question, if
Sure.
you may have the time. I was wondering, in the case of women, I remember talking to Professor Revel last year about it, screening women who come in for breast cancer and using this opportunity to offer lung cancer screening for smokers or former smokers. Do you see that possible to do maybe one day one screening test for both cancers? Would that be feasible? Or?
Why not? Yeah, you just it all depends on the situation in the screening place where the screening takes place, screening facility. But what we know is that the breast cancer screening is very well established in some countries. It's accepted by women, and if then they get the opportunity to get one additional screening, that's just an offer. It's just what you will explain them what they can profit from and the potential risks, which are very, very low. So I think the incentives are quite high, and it's even higher if this can be done in one setting.
Yeah, it would be more powerful, definitely.
Yes, definitely.
Well, thank you so much, Professor, for your time. I wish you a very good end of the day.
Thank you so much.
Good end of the conference.
And all the best for your voice.
Thank you.
Thank you so much.
Hopefully I will recover. Thank you all for watching. See you very soon for our daily wrap-up with my co-host, Ben Gizy. Mélisande Rouget signing off now. Thank you.